Channel Africa News, I am Onelin Nsinzi.
SABC News, independent and impartial.
From an African perspective.
Zambia's COVID-19 cases are now nearing 90,000 from over 1 million tests done. But what is the status of the country in getting a COVID-19 vaccine for its citizens? Arthur Davis Skopa, our Zambia correspondent, now reports.
Zambia's COVID-19 cases are now nearing 90,000. This 90,000 cases is from over 1 million tests done from March 2020, the first time the virus was detected in the country. The cases of COVID-19 being recorded daily in the country have reduced. Zambia used to record over 800 or 900 cases in a single day. But these days, the cases have reduced to just about over 100 or 250 in a day. Meanwhile, Health Minister Dr. Jonas Chanda says government is making progress in sourcing for COVID-19 vaccines for Zambia. He says steady progress has been made and that it will now not be focusing on the earlier targeted groups of people like journalists, medical workers and the elderly, but that it will be optional and that those who be willing will be given the vaccine. When the announcement was made that the first to get the vaccines would be targeted groupings such as the media and medical personnel, some questions were being raised and others rejected being the first to be used in the program.
It is our hope that the opt-in will be the case in order to enhance herd immunity and protect the citizen. In short, there will be no mandatory mass vaccination of citizens against COVID-19 when that time comes.
A medical expert, Isaac Sakala, says the country is now noting the reduced number of cases which could be attributed to warm weather the country is experiencing. Dr. Isaac Sakala, who is also Resident Doctors Association of Zambia president, however warns that the country should care and adherence not to be taken lightly, as the country may slide into the third wave as the cold season starts in May and June 2021.
We were not taken by surprise when we saw another surge during summer because of the rainfall, the lower temperatures, and now that the rains are reducing, the temperatures have begun to go up, the numbers are seemingly going down. And we do anticipate we may have a third surge should we go into May, June, when the temperatures start going down again, unless we intervene with the vaccine.
And on the non-mandatory admission of COVID-19 vaccines to Zambians once it is procured, Dr. Sakala says ideally persons have the right to choose the treatment that is given to them, even at critical point of illness.
Remember that any form of treatment, a patient has a right. So any form of treatment, be it a vaccine, be it an injection, be it an operation, a patient has a right to accept that treatment or not, even when it's a last option before they die.
And the national commentator, Felix Konoso, is advising Zambians to take heed of the COVID-19 health guidelines so as to prevent the imminent third wave of COVID-19.
Please let us follow the World Health rules to avoid this. And I would also advise the government to bring in vaccines. It's critical at this stage that the vaccines have proved effective, and I don't know why in this country the vaccines are not yet it. So those, I think, are strategies that we can use as a country to avoid this imminent third wave of COVID infection that is coming.
Zambia today has 85,240 cumulative cases from the 1.1 million tests conducted since March last year, and the death toll stands at 1,167, and 1,641 are currently undergoing treatment for COVID-19 in different health facilities and home or communities. Reporting for Channel Africa in Lusaka, Zambia, I am Arthur Davis, Skopo.
Somalia has received the first batch of 300,000 doses of COVID-19 vaccine jointly developed by AstraZeneca, a British-Swedish multinational pharmaceutical and biotechnology company with its headquarters in Cambridge, England. The vaccine will be used to inoculate Somalia's citizens against the invisible infection that has killed nearly 400 people over the last 1 year. James Shimanyula prepared the following report.
Somalia has joined other countries in sub-Saharan Africa that have received the COVID-19 vaccine under the Global Vaccine Sharing COVAX facility co-led by the World Health Organization.